Hello, everyone. It's time for my second podcast. Today is Saturday, September 28th, 2013, and this will be, of course, as I just said, the second time doing this, so still a long ways to go. The topics today will be the Affordable Care Act, better known as Obamacare, Medicare, and we're going to also talk about the minimum wage. So those will be our three topics. So primarily focus on healthcare, but we'll also be talking about minimum wage, which is a labor-related topic at the end. And this will be the first podcast to feature a wild card call-in session, similar to radio shows where you can call in, except the problem is this will not be live. So I have no idea what they will want to talk about, and they will have no idea what I will be currently saying. So I open it up to anyone watching to call in the future. You can talk about anything political related. It doesn't necessarily have to be the topics I'm talking about. With that being said, there could be some background noise because of my roommate and stuff, but we'll try to make this work. And if you are calling in, do expect some technical difficulties, given this is my first time and I'm basically running this out of a basement, just using the computer. With that being said, let's start with our discussion of the Affordable Care Act, which everyone likes to call Obamacare. So, there's a lot of things going on with the Affordable Care Act right now, and I guess the most appropriate thing to talk about at the moment is the Affordable Care Act in relation to what's going on with the government shutdown. So essentially the Republicans in the House passed a bill saying we're going to have a budget, but it will defund Obamacare, and obviously it's not going through in the Senate, and then you saw the filibuster with Senator Ted Cruz from Texas. But pretty much even moderate Republicans realize that defunding Obamacare is just not a political possibility. If you look at the statements from Senator Coburn from Oklahoma, who said basically that Ted Cruz is wrong in this and that the Republicans only control the House of Representatives. They don't control the Senate, nor do they control the presidency. And this is, of course, again, coming from Senator Coburn, who is by no means a liberal by any regards. He is a conservative Republican. And he says Ted Cruz is just not realistic in thinking that they will be able to defund Obamacare. And I really don't like this idea where they've tried to repeal it over 30 times. I understand completely that they would try to repeal it once or twice, maybe even 3 times. But over 30 just seems like they have nothing better to do, especially when there's a lot more important things on the docket that they could get to, and especially not as a bargaining chip to defund the entire government, or at least a large portion of that. With that being said, I want to talk about Obamacare specifically, its possible implications, and what I feel are false myths or criticisms about the bill. So I actually posted a Facebook status a couple of days ago, kind of going over my sentiments with Obamacare and the Affordable Care Act. And of Obamacare, I'm a huge critic of the Affordable Care Act or Obamacare. I am a big critic because I feel in many ways it's a cop-out. It doesn't go far enough. I'm a big favor of the German healthcare system, which I'll talk about in just a minute. And it's not even single-payer or Medicare for all. But with that being said, it does do a lot of good things. It does make sure that you can stay on your parents' insurance plans until you're 26. It gets rid of pre-existing conditions. It, in a sense, means universal health care, but through the private system. And there are still some, and that's not even completely true because there are some technicalities that means it's not necessarily universal. With that being said, and all these criticisms that I have, and believe me, I do have criticisms, I think experimentation is very good in a bad industry. And what I wanted to talk about with that status I posted on Facebook was the idea of marginal cost and marginal benefits. When you hit rock bottom, so to speak, the only way to go is up. And the healthcare before the Affordable Care Act was horrible, which means that implementing Obamacare had a really low marginal cost since the system was already so bad. And the potential to do good was really high, so there was a very high potential for a marginal benefit. That's why there's a lot more room for experimentation in healthcare than there is in something like Social Security, where the system itself works pretty well, but that means there's a huge cost, because if it works well and you try something new, that could lead to a very bad system. And since it already works really well, your rate of return is going to be small if you try to experiment. So experimentation with certain things can be dangerous, like Social Security. But sometimes we need experimentation to move forward. That's how science works, that's how good policy works, and especially in an industry like healthcare, which is so bad and the cost is so little, since it's already a really, really terrible system, you can do a lot of good, and that's why I want to see Obamacare take effect. The problem is a lot of the provisions in Obamacare don't take place until 2014. Some things are going to occur later this year in 2013, and some don't even go into effect till 2016. So let's let those happen. They haven't even happened yet. Let's wait a few years and see if the results back up the data, and see what happens. Because a lot of times when push comes to shove, you'll see results that don't necessarily line up with statistics or probability or predictions. For example, there's a statistic going around that a lot of small businesses won't be able to afford or will refuse to provide health care or hire full-time employees as a result of the Affordable Care Act. However, when push comes to shove and they actually have to deal with the decision, I feel like they'll actually not be as committing to what they've said, and I think they will still hire full-time workers, and you won't see the effects when push comes to shove, which means the effect has to go into effect. Which means the bill has to go into effect. But there's just all this speculation, not verified by facts. Ted Cruz has compared it to Neville Chamberlain appeasing Nazism, and it's really just blatant hyperbole for a bill that's so weak. I mean, every other industrialized country, including Israel, an ally who the Republicans love to fight over, love to say how much they love Israel every year. That country has universal health care, and yet all these countries pay less as a percentage of GDP, and most of them per capita, than the United States. And yet we have one of the worst qualities of healthcare in the industrialized world. So not only are we paying more, but we're also having a worse quality of healthcare. So with all those bad things happening, and this is pre-Obamacare, I think a little experimentation could be good. And again, Obamacare is not the system I want. The ideal system would be the German healthcare model, which I will cover right now. So Germany has a little bit of a mixed system, or a two-tiered approach, if you will. And I think the German system would be a lot more easier to sway over moderate Republicans than something like a completely universal healthcare, or something like the United Kingdom's healthcare system. So the German healthcare system, the first part works like any other universal healthcare single-payer system, essentially, that everyone pays into a system and everyone gets universal coverage through the government. So this provides for things like annual checkups, as well as catastrophic incidents such as a car accident and things like that. However, and this is the big thing that I think Germany does right that's going to help sway over conservatives, is that in Germany, if you want to buy additional supplemental insurance from private companies or private insurance companies, you are free to do that. So this allows you to maintain that choice. So if you're in the United States and you have a good healthcare system, and we implemented the German system, you would still be able to buy that additional healthcare if you so choose. But the system is great, because if you don't have health care, you can get it paid for by the government, and you can get those basic checkups, which are going to save costs in the long run if everyone is getting treated and everyone becomes healthy. And Germany pays less than the United States. I believe the current number stands that they spend about 10 to 11% of their GDP on healthcare costs. And the United States spends around 16-17. And their quality of healthcare, I was looking at some data. There isn't a definitive answer whether the U.S. or Germany has better quality of healthcare, but it seems roughly equivalent. But if they're paying less and getting the same, I feel like the German healthcare system is the way to go, especially since it covers more people as a whole, and yet you're still allowed the choice by able to buy supplemental private insurance. So Obamacare is nowhere close to that. All it does is say everyone essentially has to buy into the private system, but it also regulates against the insurance companies doing things that have traditionally discriminated against certain people, such as women. So this now allows, or children, because now, or people with pre-existing conditions, because pre-existing conditions is gone. Women now have more ability to fight for equal pay or equal costs when it comes to health care. And so it definitely provides more overall coverage, and it helps cover the poorest Americans who could not afford that. So it does some minor things. Again, it's a very weak bill, and that's why I don't understand all these claims of socialism, is that the bill is so watered down from something most in the Democratic Party want, which is some sort of single-payer Medicare for all system. And this is Obamacare, so much of a watered-down version of that, and yet it's still considered socialism, destroying this country. But what I want to ask is, did you really like the healthcare system before, and can we at least experiment for a couple years? Obamacare is definitely not the solution to our problems in the long run, and it definitely needs a lot of kinks to be worked out, and I would prefer the German healthcare system and a real universal coverage, but it's a good first step, and I feel like the benefits outweigh the costs. Again, talking about marginal benefits and marginal cost, the system is so bad that Obamacare really can't make it worse, and that's not just conjecture, but also just mathematically. And in fact, as we see in New York, premiums are actually going down, in part because of the Affordable Care Act. So with that being said, Obamacare, it's not good in the long run, but we should use it as a first step. Its benefits could outweigh the costs, and it could be a model to finally get us to some sort of single-payer system in the future. I don't like the hyperbole against it, but there are valid criticisms to be sure, and it definitely shouldn't be used as hostage in regards to the government shutdown. So with that being said, I think that covers my discussion of the Affordable Care Act, or Obamacare. I think I sufficiently spent enough time. So far, I have not received any calls. That's okay. This podcast probably doesn't have that much traction anyway. With that being said, we're going to go on to our next topic, the second topic, and that is going to be Medicare. So, Marcachelli, Mr. Joseph Marcachelli, this is a shout-out to you because your comment is what made me think that I should do Medicare as a topic for my next podcast. And so on my Facebook status, when I uploaded the first podcast, you commented on what exactly will we do with Medicare? And that's a great question. And so to give some background, last week, I never talked about Medicare directly, but I said in terms of playing poker and negotiating, Democrats should put Medicare on the table in exchange, get the tax raises they want, eliminate deductions and loopholes, and play the game smartly. We'll put aside the political poker negotiation thing, which might be another topic in the future for the side. But I want to focus on, so if we're talking about putting Medicare on the table, what exactly does that entail? All right. So there are some proposals on the table. I read some to prepare for this podcast. So here are some things I think could help Medicare. So one of these, the first thing I'm going to do is something that's like hard for me to say, because it definitely, in some ways, like, I'm against it, but realistically, like, I feel conservatives on this point do make a good job. It has to do with life expectancy. Human beings are living a lot longer than they are, a lot longer. And with that being said, people are in the workforce for a lot longer. And so I heard an interesting proposal by Senator Joe Lieberman, actually, about raising the age for Medicare. And again, this is something that was really hard for me to come out and support, but his proposal made sense. And that's starting in 2014. Given that this article was written a few years ago, I feel like a more appropriate date would be starting in 2016. What we do is we raise the minimum, we raise the age to be eligible for Medicare by 2 months until the age of 67. So it's a gradual process. It's not immediately 67. You have to wait till 67. It's every 2 years, and it starts in 2016. So it wouldn't affect you until the year 2016. And at first, and again, it's only 2 months every year. So 2016, it moves up 2 months from the current 65, I believe. And then in 2017, it moves an additional 2 months, so 4 months total. And it goes on and on. And apparently that's actually, I was looking at the numbers, a very cost-effective measure. And for something really small. And again, it's a very gradual process. And I think it makes sense because it's only at max raising it to 67. And again, once it hits 67, it doesn't go past that. It stops there. It's pretty gradual. It doesn't affect anyone immediately or in a substantially negative way, and yet it does a lot of good in terms of saving money. So I thought that was actually a pretty innovative solution, and it is true. We are living longer, and it does make sense. And I'm sure exceptions could be made for very people who have shown to do very tedious jobs, such as coal miners or trash collectors or something like that. I'm sure we can make exceptions for that. another solution to Medicare, and this is a more liberal solution, and it's even a free market solution, and that's allow competition, especially when it comes to Medicare Part D, ladies and gentlemen, competition for pharmaceuticals, because right now there's no negotiation for the prices, so all the big pharmaceutical companies get to set these high prices when there are generics right across the border in Canada that can be sold for substantially less. So negotiating prices, that is a big thing we can do to fix Medicare that actually comes from the more progressives ideologically, and it makes sense. It's a free market thing. Allow people to negotiate the price and and prevent oligopoly power by allowing competition, allowing people to get cheap generic prescription drugs, and closing the donut hole, combining Parts A and B, and some other solutions are combining Parts A and B of Medicare, and allowing a copay but making sure it doesn't go past a certain amount, so that seniors have safety of mind knowing that they won't pay more than X amount. And so all these do a very good job of cost-effective measures, and I think it's something that both parties will have to tackle at some point, and there'll have to be concessions from both sides. But I just listed some solutions that I think would be a good first step, and that's what I mean by putting Medicare on the table. And I really wouldn't mind a Medicare for All system in the future in regards going back to the first topic of the Affordable Care Act. Something like that could be feasible in the future, especially if you combined it with allowing for supplemental insurance, additional supplemental insurance. So far it's only been 16 minutes, and I feel like I've adequately covered the first two topics, in a way that I wanted to. So I feel like this podcast in the future might be reduced to a 30 to 45 minute segment, because I usually talk not too much about a certain issue. I usually say what I have to have and then move on. And so far we haven't had any calls, so I was trying to factor that in, but since there's no calls, it's just my voice. So with that being said, I might talk about additional topics at the end of this podcast just to allow it to go a little bit longer. But if you're just tuning in or you skipped ahead, so far I've covered the Affordable Care Act and Medicare, and now I'm going to be talking about the minimum wage, something that impacts me directly because I actually do get paid the little minimum wage in D.C., which is at $1 above the federal minimum wage, which is $7.25, and D.C.'s is set $1 above, so the D.C. minimum wage is $8.25, and that is exactly what I get paid, $8.25. All right, so ladies and gentlemen, let us talk about the minimum wage. This is a big topic. But in reality, I feel it's controversial, but there really aren't two sides to the argument, if that makes sense. In other words, both sides like to argue, but I feel like we have to raise the minimum wage. Even if you don't believe in raising the minimum wage per se, but most people would agree, okay, let's at least keep it at pace with inflation, right? So even if you don't believe that it should be substantially raised or there should be a living wage, I think it's at least safe to assume that I think it's fair that everyone gets paid, at least adjusted for inflation, that, look, living costs go up and people should be able to compensate for that. And if they're not, it's a little bit unfair if you think about that. And right now the minimum wage is set at a dollar amount. It is not adjusted for inflation. So it's $7.25. Well, what happens if 5 years from now prices go up 20%, but it's still $7.25? Effectively, you get paid less because everything costs more, but you're getting the same nominal amount of money. So even if you just kept track with inflation and didn't raise it above that, the minimum wage arguably could be up to $22. But realistically, you could still do $10 to $12 adjusted for inflation. The reason that there's such a discrepancy is that, again, the minimum wage is always in set nominal amounts, and so it doesn't really keep pace with inflation, which it should. And I think in the new law, I think a good concession would be, okay, raise it a couple bucks to around $9, but have it keep track with inflation. I'm not saying I would prefer a living wage of $13 an hour, which I'll get to in just a bit. But just politically, I feel like that's more than fair. And what we see is, as opposed to 30 years ago, many more single moms raising children, many more families rely on the minimum wage, and it's something that's really impacts people. And even though productivity has gone up, the medium income, actually adjusted for inflation, has gone down, and the minimum wage, if you look at the 1960 minimum wage and you adjust for inflation, it's higher than it is today. And so I feel like it's kind of sad. If minimum wage kept pace with productivity levels, it would be $22. That's not the best estimate, because in terms of healthy economics, you want your wages to be set around you want your productivity to wage ratio to be around 2 to 1. So every 2% increase in productivity, there should be a 1% increase in wages, or around there. So like 4 to 2. So if we adjusted for that ratio and your productivity levels as they stand, the minimum wage should be around, $15, $10 to $15, and yet the minimum wage is still $7.25. So no matter how you calculate it, the minimum wage should be raised, even if just adjusting for inflation alone. And I think it could actually be good for businesses overall, because people forget that your spending is my income and your income is spending. Your spending is my income and my income is my. Okay, I'm saying the analogy wrong, but the idea is, yes, it does cost. It does cost businesses more to pay a higher minimum wage, but in turn, it gives people more money, which means they can spend more money at banks, which is good for investment, or they can spend money at stores, which helps these companies grow. So again, it's called a multiplier effect, and it gets recycled in the economy. And giving those wages could definitely help stimulate spending in a positive way, because by definition, if you have a minimum wage, you're working. And that goes ahead with the earned income tax credit, which is something we'll save for another day, but it's basically a supplement to those who are working but are very poor and need additional assistance. And it goes against the whole idea that you're of the wall for laziness, because by definition, if you're getting a higher minimum wage, or if you're getting an earned income tax credit, you are by definition working, which shows that you are not just being lazy and sitting on your butt all day, but you are being a productive member of society. And so the minimum wage is something I see as non-controversial. Also, if you look at the supply and demand for the minimum wage, you actually see that most employers are still going to hire people, because they hire not so much on the wage cost per se, although that is a contributing factor, but really on need. I mean, if the minimum wage is $1 more, but I'm a business owner and I have a lot of people coming and I need someone, I'm going to hire that person as long as the value of that person working outweighs the cost of their wage. So if I hire someone and they produce $20 of revenue for me, they sell $20 worth of food in my store, and I say the wage is $11 an hour, okay, I still gain $9. And we're assuming in this case that the entire cost of paying this person is $11 and the entire benefit is $20. But with those assumptions being said, I'm going to hire not so much on the wage, but on the cost-benefit ratio. So again, this is something I talked about a little bit about last week. It's not just cost, it's those costs in real terms measured against real benefits. So the minimum wage in itself doesn't really affect business hiring, as long as they're going to be more productive, or as long as they're going to make money. And it's important for the people who do working to get that minimum wage. And another thing in regards to minimum wage is I don't believe in unpaid internships. I believe interns, at least if they're 18 or older, do deserve to get compensation for their work, because they are doing real work. And by being unpaid, they're actually driving wages down for everyone else, and making the labor market really bad in terms of worker protection and in terms of labor laws. And even if you don't believe in heavy labor protections, at least in having a decent wage to pay for your bills. Most people, even conservatives, like to say, oh, look at Henry Ford. He did a great job by paying his workers a solid wage in the free market. Well, yeah, but now that a lot of businesses can get away with paying a bad wage, they don't give a damn about their workers. And so we need to change that. And I'm not saying every business does that, because, of course, that's a generalization. A lot of businesses do care and do pay higher than the minimum wage. But oftentimes people will get paid minimum wage, which basically is a sign that if the minimum wage was less, they would indeed be paid less. And yet those people are still working, doing the same responsibilities, if not more, and deserve to get paid a wage that allows them to live decent lives. And a living wage, which is something to just care for the basic necessities of life, housing, food and stuff, not even luxury, just being able to survive. Most economists in real dollars would put that at currently in $2012 or $2013 around $13 an hour. And I'm okay with even raising the wage to $11 an hour. Just any increase would be really good, especially if it was brought to the $11, $13 level. Double digits, and I think that would be highly productive and great for workers to be able to do that. And I also think the tip ratio or tip wages should be raised as well, because I don't know the exact economics behind it, but I believe tip workers, there's like a sub-minimum wage in regards to tips. That should be raised as well. The exact numbers elude me because I've never worked as a waiter and don't really have personal experience of that, but I do know there is a sub-tip minimum wage. With that being said, I have pretty much finished what I wanted to say in regards to this podcast. I know it's been relatively brief. No calls, which is okay. With that being said, I'm going to just throw out some predictions in regards to this government shutdown, and then we'll call it that for a podcast. So in regards to this government shutdown scenario, I am not sure exactly what's going to happen. I think there will be a shutdown because I don't think the Democrats or Obama at this point are just going to cave on the Affordable Care Act, given that it's often called Obamacare, and he's probably not going to veto something that has his own name in the bill, or at least as it's referred to. And if you haven't been paying attention, the most recent thing that happened was that the House passed something similar to the original version of what they passed, but this time, instead of defunding Obamacare, in a sense, delays it. But I still think the Senate is not going to pass that. Obama's probably going to veto that if it does get passed, and it's never going to have enough time to go through a cycle to go back to the Senate, which they won't have enough votes to override the veto anyway. So I think there will be a government shutdown, but I think it's important to have a government shutdown to people realize what the government does, because obviously there's this conception from the Republican Party that the government can't do anything, but then you'll realize, oh, crap, now there won't be... Well, the thing is, most shutdowns still allow funding for essential jobs, but theoretically speaking, it's now there's someone not picking up my trash, there's not someone delivering mail. Luckily the important, and just to show you the fact that important jobs are still being used means that they are doing something. Air traffic control. What if we didn't have air traffic control? You wouldn't be able to fly planes at all during the shutdown. And you're still going to see heavy cutbacks on that. So your planes are going to face tremendous delays. The TSA is going to take longer at security lines. Less resources for police officers and for federal agencies. I believe the ATF, I know so obviously many federal law enforcement agencies still go on, but I believe the ATF faces some serious cutbacks. So when people say the government can't do anything, just watch the shutdown and see what happens. Now, granted, I'm pretty sure they're going to try to do something to save it, or at least make the shutdown as small as possible. But I think it's a good I think it will help illustrate just what the world is like without the government. And the fact that even with the shutdown, there is still funding in place for certain agencies, and essential people are required to work without pay. They're paid retroactively, but during the shutdown, they're not paid at all, and they still have to. So, for example, air traffic control just shows how important these jobs are, that even in a shutdown, they still have to work because their job is that important. So with that being said, I think that concludes my podcast. So, we talked about Obamacare, Medicare. Sorry, not Medicaid, but Medicare. And finally, the minimum wage. Again, please show this to your friends that they're interested in current events. I know this is just a college student talking about his beliefs about politics, but I do like to keep it fresh. I do like to try to do new things, and I do like to hear both sides of the issue and civil discourse with anyone. And unfortunately, there were no calls. There was no wild card call-in for this session. My fear is that I'm going to finish the podcast and I'll get a call in like 15 minutes since it's only taken 30 minutes. But that being said, this was really fun. Again, comment, listen, let me know what topics you want to hear in the future. I want to get this big. I want to get this very much focused around users and what you guys want. Because I don't want to just I don't want just me talking all the time or just me choosing the topics. I want you guys to do that. So again, another shout out to my debate coach, Mr. Joseph Marchicelli, for suggesting Medicare. So see, that made it on the show. Usually if you suggest something, I'll probably just have it on because I want to talk about it and address it directly. With that being said, this was a lot of fun. If you are listening, thanks so much. Thanks for listening to this whole podcast since you're about 30 minutes in. Hopefully you have a great day. If you are interested, let me know. Tell your friends. Let me know what topics you want to hear. If you have any suggestions, improvements, feedback, I'm happy to hear that as well. So have a great day. And this concludes my second podcast.